Are you a healthcare professional that works in and around a hospital? Do you deal with a lot of death and dying in your job? If so, I have a challenge for you, and I want to share a pet peeve of mine. So the pet peeve of mine is when people are discussing death and dying, whether it be with the patients in counseling, whether it be with patients' families who are near death or dying, or after somebody has died and we're talking to each other in the healthcare realm. When we use softening terms or like euphemisms for death and dying, drives me absolutely bonkers. So let's ask a question. When you're asking and discussing these sorts of things, hey sir, when you pass, would you prefer this or that? Don't use that language. When you say, hey, Dr. So-and-so, I wanted to let you know that the patient who is on DNR comfort orders about 5 minutes ago passed, and I want you to come pronounce. I want you to practice using died, death, dying. And you can do this without sounding grim. You can use empathy in your tone. You can show understanding. But what we're trying to do is encourage clear and concise communication about the end of somebody's life. So let's try it. Dr. Vintage, I wanted to let you know that the patient who is DNR comfort in room so-and-so has died, and I would like you to come pronounce. Or, hey, last night when that patient of ours who died, use those terms. Be very direct in your practice. The reason why is because when you're not in a habit, you revert to what societal norms are and what your own feelings are about death and dying, which we like to avoid it and we like to deny it, okay? And so this will carry over when we're communicating with families who are trying to process the very real end of somebody's life. The more clear and concise we are in those communications, the easier it is going to be for the families to move forward, okay? And so when I talk about we are going to allow natural death to occur, that's how I say it to the family. When I say this, I want to be very clear, this cancer is very aggressive and will very likely be the thing that kills you. Now, when it comes to your death, how would you sort of prefer to move forward? This is exactly how I want you to talk about it. So I want you to challenge yourself in your communication. I want you to ask yourself how you communicate around death and dying. And I want you to just change it to just using that clear, direct language. Practice it, realize how weird sometimes that might feel, but I promise you, you get used to it. It is actually quite well received, and you can practice using very clear terminology with empathy. That's my pet peeve. Leave a comment. Let me know if you feel like that this is good, bad, indifferent. Let me know if there's something out there that has dissenting opinions, and I'm so happy to hear it and have this conversation.